Deputy President Kgalema Motlanthe attended the South African National AIDS Council meeting in Bloemfontein on the 12th August 2011. The meeting was attended by, among others, the Minister of Health, Dr. Motlanthe, the Free State Premier, Kgalema, deputy ministers, as well as representatives from the civil society organizations. Among other issues discussed was the review of the HIV counseling and testing campaign. The campaign was launched in April 2010 by President Zuma. The aim of the campaign was to have at least 15 million people to test and know their HIV status. Minister of Health, Dr. Motlanthe, announced that since the launch of the campaign, 14 million people have been cancelled and 12 million have tested for HIV and AIDS in the public centers. A further 1.5 million tested at the private centers. Despite the success of the campaign, Dr. Motlanthe decried at the lack of interest from men. He says men constituted only 30% of those who tested.
We've run a campaign over a long period, and many of them are not even going to testing stations. So in whatever new strategy we are doing, we have got to target men. It can't be a campaign of men only. That number is very low. But we also say we have increased the number of people who were used to testing sixfold. That's one of the things we gained in this campaign. The actual results achieved is that 13.96 million people presented themselves for counseling, and those who accepted testing is 12.96 million. People are asking why there is such a gap of about 1 million people. Some people come for counseling, and after being cancelled, they are not ready to be tested, or they get cold feet, or they just change their mind. But I think there's also a substantial number which shows capacity. People get cancelled, they wait in a very long queue to be tested until late at night, and they just go home. So the numbers do not necessarily tally. And then the number of those who have found positive is 2.04 million. And those who are now on ART is 1.38. And the median positive rate is 17%. And for the TB screening, 7.47 million people were screened, and 994,000 were referred because they were suspicious.
Just concluded the meeting of an extended plenary session of SANAC. And one of the key issues that we looked at was an appraisal of the HCT campaign. And arising out of the HCT campaign, it's the decision from government side that henceforth there will be universal coverage in terms of antiretroviral treatment to all those who are HIV positive, with the CD4 count of 350.
After the meeting, Deputy President and his entourage visited Batu Health Center. The center provides health services to the mostly impoverished community of Batu Township. This township is the oldest township in Bloemfontein.